This conference will now be recorded.
Thank you very much for attending the AnCan Foundation Veteran Support Group for the 1st of April, 2025, and it is. And actually, the first thing I'd like to do is within the reminder, I found out that Frank Favish passed away. He was a member of this back when I started in early 2023, and eventually he was up in Ohio being treated and we out of the VA, and he was referred to I believe Ohio State, and his service was West Point and in the Army, Vietnam, and then he exited out. And it's a shame that he's passed, but prostate cancer happened to get him in the end. So he was a very nice individual. Okay, this is the Veteran Support Group, and what we do is to talk about not only VA issues, but because I'm also a military uh, retiree Air Force, we can talk about military intersection with the VA, along with I was a double dipper. In other words, I was a federal civilian, and the federal civilian health care and retirement can also intersect with the military retirement health care, which can intersect with the VA health care and benefits. So that's what we do. So let's go to Caesar. Uh, Caesar, and we
Yeah,
have you.
I go by Caesar. That's just
Caesar. Okay, yeah.
yeah. My
What
friend.
what branch of service were you, sir?
I was Army. I retired as a master sergeant.
Okay, okay, you are retired.
Mhm.
Okay, and I take it you served within the Southwest Asia area?
No, I did not.
Oh, okay, that's fine. It isn't that big of an issue, actually, depending upon where you served through your career. I take it most of your assignments were within the United States, or
Yeah, they were. I was yeah, well, I did training, some training abroad in Europe, Belgium, and but everything else was CONUS. Uh,
okay. Have you ever applied for the VA disabilities at all?
I did. I was actually awarded 100% disability
Oh,
for my service because of prostate cancer
oh, okay.
through the PACT Act for the time I was stationed at Fort Ord. I don't know if it was a unique scenario, but working with my veterans VA or veterans representative, she discovered that there was uh, I think what they called a toxic environment or toxic
Oh, absolutely.
substances
Right.
that
Yes.
were that were uh, uh, available or in the water, I guess
Right.
at Fort Ord is where I was stationed at the time.
Okay.
During,
Now, a question that I have, which I'm interested, which of the toxic agents did they tie your service to? Because I'm very interested in those.
yeah, the my I guess my hesitation with this is a lot of it's ambiguous to me. I don't know. I don't have a report that kind of showed, and maybe part of this is because it wasn't, I didn't, I wasn't the sole person submitting my claim and
Okay.
and preparing all the paperwork.
Ah,
I
okay.
worked with the VA representative from our county
Right.
here in Nevada County. I'm in California,
Oh, okay.
and, and yeah, in Truckee, California, and Nevada County is the county that
Okay.
represents my area, and so I worked with closely with a representative through the county to get my documentation done, and so maybe that's something I should have copies of just so I know more about the process. But to my surprise, I guess I say surprise because when I initially started looking into the PACT Act stuff a couple of years ago, or it might not even be that long now. It seemed definitive that things were tied to overseas deployment and wartime experiences and things like that. And so
Right.
I, but I ended up getting the award, which has been uh, invaluable at this stage in my health now, because I've also, in addition to the prostate cancer, I'm dealing with kind of a mysterious respiratory issue that has recently surfaced in the last year. And
Okay.
so I've been in the hospital quite a bit, and I'm actually going through the VA. My plan is to go through the VA for a prostatectomy. That's the
Oh,
stage
okay.
that
So
I'm in.
at this point, uh, you have been diagnosed,
Yes,
and you're actually in the flow of things, you were diagnosed. You would have been then classed on probably active surveillance at one point,
correct.
and now you're attempting to figure out a treatment plan or a treat. And how old are you now?
I'm 56.
56. What is available to you, and I'll give a sort of a plug, is that we do have groups within the AnCan Foundation that are geared to you. And in fact, there are two groups that you might well be very, very interested in. There is a low intermediate prostate cancer group run by Dr. Mark Perlow, and it can help you decide what kind of treatment there is. Plus, there is a second group for men under 60, because men under 60 have some unique issues, I'm told, but I'm not. I am long past 60, maybe
Yeah.
20 years past
Oh gosh.
60. And so, in the scheme of things, we could talk about all of the prostate kinds of things we do it, but this is a veteran support group, and
Yeah.
so what you can do, if you would like, is to send me your email address, and I can sign you up for those. And the low intermediate group meets 2 times a month on the second and fourth Mondays, but
Yes.
because
No,
of
I'm familiar with that.
April, huh?
I have that on my schedule. I attended a couple of the active surveillance
Okay.
AnCan meetings already, and I became
Oh, okay.
familiar with now my next step is to start attending the low to intermediate
Yes,
risk.
please do.
Yeah.
Now, let's let's start to look at this from the VA perspective, okay? because the thing that happens is either way, if you pick surgery, that's one thing. If you pick radiation, is the other. Okay. Um, Surgery. Okay. In the VA world, any surgery you have, they don't they don't differentiate between what kind of surgery. You are going to, from the time of the surgery, you will be 100% temporarily disabled. Okay. And at the end of 6 months, they are going to want to downgrade you based upon residuals. Okay. Now, if you do radiation, it is 3 months. Okay. Now, what is not very apparent to the VA, and because of sticking on essentially a prostate cancer hat here, what your treatment plan is if you get surgery, what will happen in most all cases is your treatment will continue, because what they have to do, or what they do is to then give you then a PSA test every 3 months for 1 year. Okay. Following your surgery, which means that during that 1 year period, you are to remain 100% temporarily disabled. Okay. And the same thing goes for radiation. At the end of 3 months, the VA will probably step in, okay, on a C and a P exam. And at that point, you have to explain to them that your treatment plan says that you are still under treatment for 1 year. Okay.
Okay.
Now,
That's good advice.
not to complicate the issue, but depending upon how um, how aggressive yours is, you may also be put onto then ADT, androgen deprivation therapy. And if that happens, there could be surgery plus a year of ADT. There could even be 18 months. There may even be 2 years of it. And if that happens, all during that time, you will claim 100% temporarily disabled. Okay.
Okay.
And the same goes for the radiation. Now, at that point in time, when we get to the downgrade point, they are going to call you in for a CNP exam, which at first I got real curious about how they are standardizing all these um, folks all over the country. And I finally stumbled across the fact that a CNP examiner has a form to fill out, and it's called a defined benefit questionnaire. And the thing you'll do is to walk in there not knowing anything about it, and they'll start asking you questions, and you will give them answers, and out of it, you will get a rating. Well, these defined benefit questionnaires are available to you if you know where to look. We know where to look. Now, also, the answers to the questions, or the possible answers, could be that you are rated 10%, 20, 30, 40, or 60. The answers to those, or the possible answers, are out there on the internet, which you will become familiar with, not to lie, but to make sure that you understand what the answer you give will equate to how much. Okay. And the goal, well, actually, for you, because you were exposed to toxic materials, okay? When was your claim done offhand? Was it done in 2024, 2023, or what?
I think it was, gosh, that's a really good question. So much time and so many issues have flown by. I think it was at the end of 23, September of 23.
Okay, now the thing that hasn't happened yet is at the time that they will adjudicate this claim, the thing that happened March the 5th of 2024, there was a thing called TERA came about, toxic exposure risk activity. And the long and the short says anybody that can, well, by default, Agent Orange coverage types uh, like a bunch of us in here are automatically under TERA. Gulf War people automatically under TERA. Radiation exposure under TERA. But for and what that means is at the time they understand that there is a TERA memorandum created within your healthcare file. This will entitle you or entitle anybody, even in perfect health, to 100% free VA healthcare. And so, although with you being 100%, or depending upon what you happen to downgrade to, if you downgrade, let's say, downgrade to 40%, then the only healthcare, free healthcare you're entitled to will be what you are rated for. But once you get to 50, you get everything, or you have the TERA memorandum in your healthcare file. So, in the scheme of things, the thing that I can do is to help you at the time that you go to file the claim, and so that would probably be at the point that um, you decide on the treatment, have it done, and then file the claim. Also, out of the 2-1, you will also file for a thing called loss of use of creative organ. Because if you file for ED, you will always get 0. You never get anything for ED. Why? It's dysfunction. What, in essence, a number of us have is malfunction. Okay? Because that's the way it works. Now, it doesn't mean you can't have sex out of it, but it's quite involved. But according to the VA, there's a separate law that has determined our value in the bedroom equated to money. Are you single, married, or what?
I'm married. Yeah.
Do not tell the wife this, but you are worth $136.06 a month in the bedroom.
Oh, God.
And it's an
I
extra
think you'd
payment.
probably agree with that. Yeah.
Right. It's an extra payment on top of whatever money you get. Now, the ideal thing, because of the military aspect of this, is when the smoke clears out of all of this stuff, you want to be at least 45, which is rounded to 50. And the reason is if you are 10, 20, 30, or 40, any money you get out of the VA will be deducted from your Army check.
I just recently read that. Yeah.
Right.
Yep.
So the goal is, my goal is for everybody to get at least 45, which is rounded up to 50. They round up, they round down. So, in essence, the thing I would do is concentrate on the prostate cancer claim. It should be fairly well, actually, you already have the claim in, right? Well, you have it active surveillance, right?
I have been on active surveillance, yes.
Okay, so the only claim that you would put in is after you have your treatment, whatever it is, okay, radiation surgery, is to put in a loss of use of creative organ. And that would be a service connection of secondary to the prostate cancer. Because if you didn't have the prostate cancer, you wouldn't have had this issue with loss of use. And it just so happens I have a number of those already almost canned that you can have, and it isn't difficult to do your own claim. My goal is to teach you how to do your own claim, not to do it for you. And then it is very easy to upload your claim using Access VA. And so, as I said, I can step you through because for you on the form, it would just be probably it would be a 526 EZ form, a VBA 20 526 EZ, and then the other form to describe your disability. And as I said, that would be a matter of maybe a day or two at the most on your part. Okay? Now, once that one's in and you are in your 1 year, 100% temporarily, the strategy would be now if you've got other little things to file, like hearing, tinnitus, I don't know what all you might have, and start to build up those,
Mm-hmm.
you know, a 10% here, a 20% there, a 10% there, which means eventually at the downgrade period, if there is a 30% for the prostate, if you take the 10, the 20, and the 10 and the 30, you're going to be about 50 or so, or it could be 60. So does that make sense?
Yeah, and I appreciate you going into detail about this, Jim. I've done a little bit of research, and a lot of what you're
Okay.
talking about is familiar to me. Like I said, I just recently read about um, the 50%, kind of almost like a garnishment thing. They'll take away from your retirement benefit or whatever. But yeah, so I certainly appreciate the information. You know, I think my claim thus far has been, um, you know, super beneficial. I mean, for me, the medical care has been tremendously valuable as I've been, as I
Oh,
mentioned,
yes.
dealing with a lot, and I'm going to be going, probably to have a prostatectomy, within the
Mhm.
next few months. I'm at that stage. I've moved from active surveillance, and now my PSA is above 20, and I've got uh, also some Gleason 7 from my last biopsy, and so that kind of puts me into that low uh, um, to intermediate risk category. And after meeting with my urologist at the VA in San Francisco, he I still have a meeting with the surgeon in April 14th. Actually, we're in April now, this month.
Okay.
And But my urologist, the resident that I initially spoke to, said more than likely he's going to recommend surgery, not radiation, mainly based on my age. But
Okay.
you don't really need to go into detail about that here.
Well, just out of curiosity, you said a 7. Is it a 7 3 4 or
It's
a
a
4
3-4.
3?
Yeah.
Okay, it's a 3 4. All right. How many cores offhand?
It was actually 3 out of 30 cores. It was a
Ooh,
saturation biopsy. It was a 30
boy,
core biopsy.
they
Yeah,
were
they did it.
serious.
It was my fourth biopsy, and this was done at the VA in Reno. My urologist there recommended the saturation biopsy because all of my prior biopsies had only shown Gleason 6, even though my PSA had been steadily climbing. And
Right.
so that's why
Good
they
idea.
did the 30 core, and that's what resulted in showing some Gleason 7, um, uh, yeah, uh, cancer. And so you know,
Okay.
basically, and so it's been 3 urologists now that have said, yeah, you've got to go to that next level of treatment. Now it's just a
Yeah,
matter.
it is. Just out of curiosity, on the biopsy report, was there anything about seminal vesicle invasion?
No,
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 anything? Good.
yeah, there was not. As a
Oh,
matter of
good.
fact, the VA resident that I saw at San Francisco a few months ago ordered a PSMA PET scan for me,
Okay.
which I think is rare. I don't think that happens in the civilian world where,
Well, yeah,
you
well,
know,
yes and no, depending upon if you ask for it now.
oh,
It
okay.
it is becoming more and more a good idea. So I
Yeah,
take
it
it.
seems like it. It might just be the expense of it because
No,
after
no,
kind of
no.
learning what it is, I thought, this should just be happening kind of by default,
Well, well,
Fortunately, I
there
was
is
negative.
a story behind that, which is not really for here, but it is in trials to, well, actually, to us, it should be a no-brainer to do it, but all of the trials and the approvals was for late stage. It is only now being uh, because you have to have a trial done and it has to be FDA approved. Otherwise, it's done off label. So, yes,
Oh,
probably in a year or two, it'll be like standard equipment.
yeah.
Oh, good, 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 good. Now, just offhand, what might you be thinking about claiming after your prostate cancer? Is there
Well,
anything that you can
I
attribute?
did. I did a tinnitus claim. So I did get that initial 10%. That was a couple of years ago.
Oh,
Um,
okay.
yeah, so I already have that.
Okay,
I
you got
also
10.
one of the things that I got 10% for that. Um, eh, um,
Okay,
my VA rep or veterans rep from Nevada
okay.
County, I'd been talking to her. I drop into the office, a couple times a year to say hi and
Sure.
to check in on them. And I'd been telling her, she'd asked, are you dealing with any other health issues? And I told her about this kind of mystery respiratory issue that I've been dealing
Okay.
with, persistent and severe asthma that I'm actually just getting over an exacerbation today. It's the best I've felt in a little over a week.
Okay.
But she recommended that based on my job, while I was in the military, I was a dental lab tech, which is kind of one of those those rare
Oh,
MOSs that a lot of people don't know about.
hey, sir, you are fortunate because it just so happens that a high school classmate was a dental tech within the Vietnam War, and
Oh,
but he was in Guam. Well, within the PACT Act, they then essentially added Guam. And so he had a number of issues about that. And so I did a very in depth study and I did his claim. Now,
oh,
did you by chance make teeth and all of that stuff?
I did. Yeah, that's what I
Do
did
you
for
know
years.
the word called monomer?
Well, I do. That's what I actually submit. So my
Yeah.
rep helped me submit a claim for methyl methacrylate.
Yes.
And yeah,
I did the same for him.
yeah.
And has that claim been adjudicated yet?
No, the claim is literally just 3 weeks old.
Okay,
Um,
now,
really, my rep
let
helped me.
me also, do you have anything like essentially hiatal hernias out of it?
No,
Do you have a stricture, a ring stricture?
no, no.
Okay, another thing that you should get tested for is it's a thing called Barrett's esophagus. And what happens is within the esophageal cells at the time that you damage them, which monomer is known to cause that. Okay. And the thing that happens is the esophageal cells are damaged. What will replace them are stomach cells. Now,
Mm.
generally, the thing that happens is that doctors who perform that endoscopy thing go down and they never check for it. Why? Because the chances of you developing cancer in your throat are about 15%. Now, up until about 2015, there was no treatment available for it. But starting in about 2014, 15, I know because I do have it myself, and my um, doctor got in all of the equipment to treat that puppy, and he looked at me and said, Jim, I've never had so much fun in my life. And he was about 66. And he had a twinkle in his, he said, how would you like to be my first patient? So anyway, I know that well, and it turned out that I was treated, but the difficulty is after you're treated, one event, acid up through the throat will cause a few of the cells. So the thing that you do is to just have them uh, check because a Barrett's esophagus in the VA world is 40% flat rate. And since you were exposed to that stuff, and if you need any of the justification, I wrote up his claim and uh, and it was for actually GERD, okay?
Mhm.
And you know, I have the um, stuff. I have everything um, medically, tying it to it, the studies, and
Hmm.
I would be happy to give it to you.
Well, thanks, Jim. Right now my claim is in the rating. Um,
Oh, okay. Oh, I thought you said it was only about 3 weeks old. I thought it was just being
well,
repaired.
that's the surprising thing. I'm in the VA app quite a bit because I
Okay.
communicate with my doctors through the app. I've met sending messages. Just sent one this morning about trying to get a biologic prescription for a special drug. But but yeah, so because I'm in there, I checked and I thought, wow, this claim seems to be going through or at least moving fast. Within a few weeks, it's gone, from submission to the rating stage. I don't know
Okay.
how much, I don't know how long these things take, but
Well, actually, it sounds like what your person did was to submit what is called a fully developed claim. In other words, everything that the adjudicator needed
okay,
was submitted at the time it was submitted, so it goes straight into thing. Otherwise, it's a standard claim, and a standard claim can take
I see.
5 months, 6 months, 8 months, even a year.
Okay.
But yes, the goal is to put together a fully developed claim. Well, depending upon how it comes out, if indeed it isn't what you think it is, I've got everything for you to go back in, okay, as a supplemental.
Mhm. Okay.
And,
Well, I'll
and
keep that
it
in
would be
mind.
a common thing, so just keep that in. But eventually, the thing after it is, well, at some point, you should be checked out for then Barrett's esophagus.
Okay. Yeah, I have that written down.
And it's an easy thing to do. And as I said, if you
Right.
do have it, it's a 40% flat rate.
Okay.
Okay?
And it's Barrett's just like a name.
Barrett
Okay.
apostrophe S esophagus.
Okay. Well,
And
thank you. It's been good information.
okay. Okay. Anything else that you would like to ask, or
What,
any other?
nothing really related specifically to me. I was more curious. I've been
Okay.
wanting to attend this meeting. Just to kind of get a little camaraderie with,
Sure.
fellow service members and retirees, but I, I know that there's been. I don't pay a lot of attention to the news, but there's been a lot of talk about different departments and cuts and budgets and programs. I don't know. I mean, has that affected the VA substantially at all? I mean, could this start affecting benefits in the long term?
I hey, I worked for the feds as a civilian for 22 years. I went through uh, Bush 1, Clinton, Bush 2, Obama, et cetera, et cetera. And don't get yourself wrapped up in that thing, because uh, have you are you getting our reminders or the reminder out of the veterans group?
I get the emails. Yes.
Well, in there, I believe in the last one, there was a link to a sort of a talk by the Secretary of the VA, and as he said, "Hey, do not worry about this." Okay, I would not get wrapped up in the politics, because the politics is a blood sport. You think a war is bad? Come around here and listen to all of the politicians try to upset everybody. Trust me, it
Okay.
isn't worth
Well,
it.
that's good insight too. Yeah.
Okay. Okay. Anything else?
No, that's it. Happy to be here.
Okay. Great.
Oh,
Okay.
and being I got your note about I'll ask my doctor about those treatment options. I've read about a couple of them. But, yeah,
Wait. Treatment options for.
prostate cancer being at
Well,
worst.
actually, you
Okay,
should talk about that within the low intermediate group.
right.
Attend that group and talk to Mark about it, and then understand what's going to happen to you when you get a prostatectomy. Okay, because the thing I will, since we've got some time, it's germane, the case of the disappearing Secretary of Defense. Did you hear about that one? The Secretary of Defense disappeared for 5 days at the Christmas of 2023,
No.
and he was not to be found. Well, it turned out that in late November, early December, he was told that he had prostate cancer. Okay, and he then had it removed. Okay, and um, Secretary of well, he's a general. Ashton, I think is his name, or
Austin.
Austin, right? Austin. So he goes home, and now if you understand how it works, there's a bladder and there's a urethra that goes out of the bladder through a sphincter muscle. Okay, out of the sphincter muscle, it goes through essentially the prostate, and he had a large one. He had a big one. Then it comes out of the prostate, goes through a sphincter muscle, and then proceeds down, out to your penis. Okay, so the surgery clips on the bottom side of the top sphincter muscle and on the bottom side of the bottom sphincter muscle, so you lose a prostate and a sphincter muscle at the same time. And now you have two ends that could be a couple of inches apart, right? So to join them, you have to pull the urethra back enough to join it to the top urethra and then sew it, extract. Okay, fine. Now he goes home. Incontinence, he then generally immediately after that, you cannot control it, which means you have to wear what is called politically accepted. It's called Depends, but it's a diaper. Okay, so here is this four-star general, Secretary of Defense, now has to wear a diaper, but nobody knew about this because he had checked himself into um, Walter Reed under an assumed name, put into a special wing, because this can be a very traumatic experience for a man. And there are. And yes, it is. So now, towards Christmas time, he gets a severe UTI, a urinary tract infection, and he panics. And even to the ambulance that came to get him wasn't allowed to turn on the lights. It kind of cruised in there in the dark, picked him up, took him to Walter Reed. He was there under his thing, and he was treated secluded. Okay, and he panicked. Okay, and he was out of pocket for 5 days. And finally, he was saying, well, out of it, there's a group called ASPE. I think you have heard of them, haven't you, Caesar?
No.
ASPE, Active Surveillance Patients International. Howard Walensky is in it. Howard is that Pulitzer Prize winning medical journalist. And so he wrote a letter to General Austin telling him that he should be a poster child for the prostate cancer testing, especially within the African American community. And he got about 40 doctors anyway to sign it, who were the leading doctors in the country. And then anyway, I got to sign it because anyway, I was a captain. Here is a military guy saying that too, a captain to a general. And so they sent it to him, and he has, which I'm glad he did, because the testing is not well received around the country. A lot of guys refuse to get tested in it. So just understand the side effects of what you would get out of that, and also radiation wise, and then make your choice. Okay.
Yep. Thank you.
Okay. Joe left, which I wish I would have known that he would be having to leave early. So, Richard, what do you got for us?
Oh yeah, this is real quick. Just to
Okay.
follow up on me tracking my supplemental grant. Originally I talked about I thought there was like 3 phases, but in one of the conversations I brought it up, and it was revealed that there's actually like 8 steps.
Yeah.
So I've been calling them every couple of weeks, and found out that this supplemental appeal has been submitted in January. And so I asked him, so where is this? And he said, you're probably, they looked at it and he couldn't tell me precisely. He said, I would say 4.5, which is they've got the evidence and they're about ready to move it into decision phase. So I guess my point here is that this is taking a long time from January. The interesting thing, I brought up this interesting point that Mark had mentioned a while back about how in his case he was tracking it going from city to city. And so I said, is this thing moving from city to city? He said, no. We can't tell you if it's moving from city to city. So Mark, I tried to find out what city it was in based on your background or your experience. They didn't want to tell me. So long story short, this has taken a long time. It was submitted in January, and out of the 8 steps, I'm at 4.5 at this date.
Well, actually, I'm going to say that it isn't in the VA world a long time, because it's only been January, February, March. That's only 3 months. In the VA world, I submitted a claim, and it was a fully developed claim until I got cute, and I thought it was a fully developed claim, and I checked asbestos just to inform them that somewhere along the road I was exposed to asbestos. And so all of a sudden my fully developed claim was turned into a standard claim, because a nice person wrote me a letter and said, "You checked asbestos. Did you mean to claim something for asbestos? Because if you did, you forgot to put it in there." And so I had to write back and say, "No, I did not mean to claim." Well, that turned it into a standard claim, and it took 5 months for just a trivial item to do it. So, hey, as long as it's moving, that's great.
Yeah, well, it's moving along like a herd of turtles.
Yeah. Okay, Mark.
I am so sorry, Richard. You're running into this. I've I've been doing this, like I've said over and over again, since '78. Uh, they'll do this to you. They'll twist it and everything else. If he or she told you, I can't tell you where it's on a screen that tells him where it's at. So I just want to let you know that uh, you just quite haven't pushed the right person at the right time on a Monday, Wednesday, or whatever. But if they say I can't tell you where it's at, that's because it's not in front of them. They know where it's at. But it's just I
Okay.
was lucky a couple of times and had it that way. But um, like I've said to a bunch of people, that's your claim. You should be able to know where it's at, and if it's in a certain uh, process period, they know in that process period where it's at, because somebody knows where that claim's at. They just don't want to share it with you. So
Yeah,
I'm sorry. Good try.
but I think that, as you well know, it's sort of the what I would call the call center lotto. Sometimes you'll hit it off with somebody, and sometimes you won't. And the
That's right.
people that you can tell that you hit it off with, Yeah, they'll tell you. They'll get,
Oh yeah,
they'll be really nice with you. But the others,
yeah,
pooh, geez, not
yeah.
not.
They probably have gotten their hands smacked before, and they
Yeah.
just don't want to go. They don't want to go
Yeah.
through that. But uh, sometimes if they see, and I see the colonel shaking his head up and down, but it's out there. It's just they just don't want to share that information. But one of the things it is that if they know that you're looking for it, that kind of pushes it a little bit too, because they don't want it on their desk. Because Richard's been calling me, and I don't really want to talk to Richard no more. So it's kind of that way too.
Yeah, yeah, you're right, because they can see on the screen when you called, and they'll see all those series of calls. So I'm kind of in between, so I'm just doing it every 2 weeks.
Yeah. Okay, Richard.
Okay,
Uh, okay, anything else?
that'll do it.
Okay. Okay, Bill.
Yeah, perhaps I'll ask this in our national capital region group as well. But
Okay.
the question in my
Okay.
mind, because I hear this a lot in the active surveillance and the low risk group, is um, there seems to be an expectation that you get a second opinion from a small handful of um, well regarded experts. So I'm just wondering, if has anyone gotten a second opinion from your military urologist, or like my doctor heads up the Walter Reed Prostate Center, and he's well regarded.
Okay,
Um,
is it Chestnut?
it is Dr. Chestnut.
Hey, yes. Well, yeah, now, to be honest, Walter Reed is very good at removing prostate. Chestnut is amazing if you want to go that route. Okay. But now, in the support groups that I've been associated with, I think I'd say 95% of the people that come into that group decide to have it removed. Okay. And there is a lot to be considered: age, what it is, Gleason score, et cetera, et cetera. Now, the thing that, the only thing that I am part to that group, it's a choice, but what you ought to run is a nomogram, okay, prior to making any decision. Okay, the nomogram is out of uh, Memorial Sloan Kettering, okay, and it is backed up by about 20 years of data, and it's very, very easy to run. The premise of it says what I'm going to do is to input my statistics, okay, the Gleason score, et cetera, et cetera. And let's pretend that I had the gland removed. And what are the chances that down the road I'm going to have radiation anyway? Okay, what are the chances? So if, let's just say that you stick it in there and there is like a 20% chance, then hey, maybe it is the right move. But maybe you stick it in there and there is a 75% chance that you're going to have radiation anyway. So why have all of the side effects of having the gland removed and have the side effects from radiation at the same time? I mean, although it's a personal choice. So now a second opinion just depends on you, how comfortable are you with what's going to happen to you when you have it removed? Because they are very good at it. Chestnut is amazing. I don't think in the 4 years I've ever heard anybody say anything against him or anything against how he happens to work. The man's amazing. So,
I do get that impression. It's the other groups, the other AnCan groups, that it seems to be a foregone conclusion that a second opinion
well,
is
that's
part of the question.
that's what. Well, that's to me anything that is that serious. Uh, you know, I believe happens to warrant a second opinion. Uh, Colonel, would
Yeah.
you like to chime in?
Yes, yes. I was going to say, I think, Bill, when you listen to those other AnCan groups, you also have to put it into perspective. They're not talking about a second opinion on everything. They're talking about a very specific case where you're trying to make a decision between um, whether you have surgery or whether you have radiation. And more specifically, it generally is tied to the reading of your biopsy slides, of your biopsy results, because that interpretation by two different people could drive your decision on your treatment option. So they're not saying every time you do something along the way, you got to get a second opinion. They're talking about in a specific case where you need to make a decision.
Okay, I can appreciate that. I guess the second opinion question is, you know, is it time for you to receive treatment versus continue on active surveillance? That's where I'm perceiving this. A lot of the AnCan groups second
Right.
opinion.
But it's also, yes, but it's also based on getting somebody that sees enough uh, of the biopsy results, because you don't want somebody who's just doesn't see them because they process all kinds of radiation, those radiation results. You want somebody who actually looks at more at prostate cancer. That's what they're trying to guide you towards, which is why you also hear them talk about getting a medical I can't even pronounce it, but a guy who just specializes in the prostate or diseases of the urinary tract.
Mm,
That's what the push is for.
Well,
okay.
actually, the first second opinion should be sent on the slides themselves.
Hmm.
Okay, to make sure that the score is correct. After that, then there is a lot of other things that fold into this: age, um, health conditions, and then your understanding what are going to be the side effects that you're going to encounter in the beginning. Okay, and removal, the side effects will hit you in the very beginning. Radiation can be 2 or 3 years down the road. Mark, chime in here.
Bill, when I was diagnosed 10 years ago, I came on AnCan and I was on active surveillance for 8 years on active surveillance. One of the things that drove it was my PSAs and my slides, and then also my knowledge. And I looked at um, my disease as where it is at today, and try not to panic about it. So what I did is it was a mental thing to not get all worked up with, well, this group says this and this group says that. I just try to go to the groups and listen to a lot of people. But the whole thing is I only had one second opinion. After that, I've had other slides, but I never went back to the second opinion thing. I just constantly stayed at uh, what I wanted, and down the road, I let medical, you know, uh, uh, medical, help me out here, Colonel. The way
That
the medical field uh, kept getting better and better and better. So if I would have had a prostatectomy at the very beginning, I would have been suffering with this for 10 years, where I waited 8 years before I had radiation. And a lot of things had changed prior to me deciding radiation. My numbers, my 3+4s and everything else, PSAs going up and stuff like that. So when I decided to make that decision and I went with radiation, when you make that decision, you're making that decision based on today. And so you can't get caught up. But mine's been 2 years. I can't get caught up with, well, today's medicine's better than that and everything else. I made my decision 2 years ago, and with that decision, I've made that decision, stuck with it. And am I having issues with the hormonal treatment stuff? Yeah, but at the same time, I made my decision based on me. I mean, people are going out there and spending all this money. I want a second opinion, second opinion, second opinion. Sooner or later, you've got to talk that out of your head and just say, this is me. I've listened to all these other people, but it's your turn to make that decision, not
Sure.
what everybody else is saying. Because you go into some of these deeper AnCans, there's gentlemen out there that have removals, radiation, and everything else. And then Jimmy knows too, those are other groups out there. They're spending thousands of dollars traveling throughout America to get their treatment. So, in the Veterans Administration here, if you're getting your stuff at the Veterans, like me, I had all my stuff done at the Veterans. Like me, I take those trips and doctors' opinions, and between that's where my treatment comes from. All my treatments come from the VA, except for my radiation, and they had to send me on the street for community care. But as soon as that last radiation shot was done, boom, right back to the VA. And I've gotten nothing but good treatment. So I
Yeah,
don't
okay.
question our
yeah.
people. But yep,
Likewise. Yep. Because I've been
yep,
strictly DOD and I haven't had nowhere near the issues, and I decided to do surgery
yep,
for my particular case. But the
right.
but the but the bottom line is, I think tied with the VA and the DOD system, despite what you hear, we don't have the doctors have the same biases and incentives, because our doctors basically don't care
Yeah.
in sense what you do. They're not trying to steer you one way or the other.
And my particular doctor he's a surgeon, so he wanted to remove it, and I said no, that's okay. I love you, but no. And so he said, okay, and where do you want to go? And so that's the way we worked it there. So what I
Okay,
used and what I did is different than the colonel.
okay, gentlemen, uh, let's focus back on the VA, although I did let it go a little long only because a lot of veterans now are getting prostate cancer. And I know probably about half of the Vietnam vets are coming up with it, and it's something that everybody ought to understand. So, okay. Do you have anything else, Bill, within the VA line?
Not for this meeting. No.
And I take it you are 100% temporarily disabled at this point in time.
Yes, I am.
Okay, good. And are you thinking about filing for other things? Because at some point in time, if things all go well, you will be downgraded. So do you have things that you could start to file now to get them in your back pocket?
So I was rated at 50% for various, I guess I'll call them orthopedic issues, mostly spondylosis.
Okay.
And I had submitted what I thought was, again, a fully formed claim recently. I did, had to include the cancer diagnosis. And I don't think they changed. They had some things missing, or that they didn't consider, and I think they just either didn't look at them. So it had some issues related to that spondylosis that's crushing my spinal cord, and I was pretty disappointed. I felt like they just kind of went with, well, you've got cancer, so this is an easy.
No, how did you make the service connection? In
Well,
other words, for the spondylosis.
it's, I suppose, my aviation career.
Okay, but how did you specifically state service connection, or did you?
Service connection is through some 1950s designed seats in helicopters where I had,
Okay,
made 1,200 shipboard landings.
okay, and
Not all of them gentle.
right. Did you supply any information about that? Any reports that stated that, or any evidence that they would consider? If you didn't, I can understand it, because in the scheme of things, the VA is not very well, doesn't tell you how to present your claim.
Certainly.
They are very lacking in that. And so the thing that I've come up with is a sort of a crude template. And the template says that you need to include 4 parts. Part 1 is establish service connection, whatever it is. Like Cesar in his uh, dental career was exposed to monomer, which is now considered to be a toxic material. So the service connection was um, he then worked in the field. Probably at that time there was not adequate ventilation, and they didn't take any steps. And then to supply the independent medical reports now that says it can cause all kinds of problems. Then after that, you do the disability itself. I've got it. And supply doctor's statements that says, yep, by golly, he does have it. Part 3 of this is recurring medical appointments, and like a CT scan every 6 months, and medications, making sure that when you list medications, you put generic drug, not trade names. The VA wants generic names. They don't tell you that until you have to wangle it out of them. And then the last part is the effects, the physical, psychological, and sociological. And those are the 4 parts. So the thing that, if you're interested, we could uh, review that at some point in time,
Okay.
if you want.
Yep. I might do that.
Choice. Okay. Anything else?
No, that's it for me.
Okay. Bing, I think you said you might have something to bring up.
Well, a couple things. One, and thanks, Jim. And good to see you, Rick. We put out a note for anybody that hasn't been tested or hasn't been, I guess, diagnosed. I think or they're in active surveillance. You can be diagnosed and you're not on antibiotics. There's a test that's ongoing. It's a microbiome test. They're actually looking at how they can diagnose prostate cancer right now through your stomach, through the biomes in your stomach. And you can sign up online. I'll put the link in a chat here real quick. It's real easy. All they do is you go to a site, answer a few questions, and they send you a box. It's almost like Cologuard, right? They send you the box, you get a stool sample, and you send it back to them, and you get a free stomach assessment of your whole digestive tract, and then they'll also tell you, they'll call you and talk to you if it shows that you're coming up positive for prostate cancer. So I think it's something that to put out to the guys if anybody's there, and the VA's recognized it. The guy, it's Dr. Mike Liss, who's at UCSD, but he developed this in the San Antonio VA. So it's the VA physician community, or the urologists in the VA are all aware of it, and you can take the results into them, and they'll then put it in your records and start talking to you about the next steps for prostate cancer diagnosis. So that's one. Yeah, it's kind of cool. And Jim, I'll send you a note. I'll put the thing in the chat room here. And also I put in here too, this is a VA problem and you have to fight for it sometime, but there's a lot of PC markers. There's a lot of prostate cancer biomarkers that are on the market now too. And a lot of doctors, they got some grants and they put together some independent funding actually from some NFL football players, a website called pcmarkers.com. And it's in the link there. I would suggest you give that to your urologist if you see him, if you're having a discussion with him. There's two sides to that website. One is for patients specifically, and one is for physicians, and it's actually for primary care physicians. And it talks about the new guidelines that they're pushing to start having the discussion around prostate cancer for veterans at age 40. And if your PSA is at a 1.5, that's the new number now. Okay, so, and they're encouraging you, there's a whole series of biomarkers or blood and urine tests that the site's very good about telling you what they're used for and when they would come into play, and telling you whether you're going to have an aggressive form of the disease. And what that's doing is it's helping you make those decisions on whether you want to go down the surgery path or the radiation path or the other different ablative paths.
Okay.
But it's worth having the information. It's out there. It's available. It's just all new technology, and it's just good information. And I encourage everybody to take a look at it. And then there's all sorts of links to people like Neil Shore, and I think Rick will tell you, Rick Shore or Neil Shore, Mike Liss is on there, David Crawford's in there, Neil Gamella, a bunch of the high-end physicians out of all over the nation are the ones that are sponsoring this whole site. They're trying to get guys to start using these biomarkers earlier. They don't have any financial incentive. It's just good technology that's out on the street now. It's just not getting enough promotion.
Okay.
So Bing, just to complete the promo, tomorrow, gents, at 7:30 p.m. Eastern, 4:30 p.m. Pacific, and everywhere in between, we will be receiving Dr. Liss in the AnCan Barniscus room. I put the link in there. He's going to do a 30-minute presentation on his biomarkers before the active surveillance group starts. Yeah. So come on in. Even if you're not a 3+3, he's looking for 3+3 men for his trial, but his presentation will be very interesting. I've heard it. I heard it on Cancer Patient Labs. I will give you a little heads up that you can have a perfectly balanced microbiome if you eat 30 vegetables a week. And some of you guys, he suggests you put a list on you keep a list on your refrigerator door and add to them, which I have actually tried. I got up to 22 one week. That was my best that I got
Okay.
to. But the idea is that this is very natural. And if you do have natural, healthy microbiome, it's going to help you fight disease, especially prostate cancer. And he wants to encourage everybody to try and follow a healthy diet.
Okay.
So, you can see Dr. Listen is Dancing Veggies tomorrow at 4:30 Pacific, 7:30. Not in this room. Don't come into this room. You want to go into the other room, the Barniscus room, and the link is there. And we hope we'll see you tomorrow. It's worthwhile. It's
And,
really it's good
and Rick,
stuff.
remember, you may want to mention Rick. He's a prominent urologist too,
Yeah.
that's come up with this. He's not he's not an internist, or he's not a nutritionist and that kind of stuff. He is a urologist that
Yeah.
goes into surgery every day. And
Yeah.
he was just
Okay.
telling me the other day that he just removed a 38-year-old Navy fighter pilot's prostate.
Yeah.
And they're
Yeah.
finding it earlier and much more aggressive.
Yeah.
And so everybody needs to pay attention to this and pass the word, pass it down to your kids, your neighbors, and everybody else to start thinking about it. And go get your test.
Absolutely. No, I couldn't agree with you more, Bing. I mean, we see it earlier and earlier, and the one thing we do know is if we can catch it early, we can keep you the right side of the grass, right, Bing?
Yep, you got it. And no, this is good. It's good information and that sort of stuff. And um, Caesar, we were talking, and I hope that you have a good case to go get a PSMA. If they're talking about doing a surgery on you, you need to go get a PSMA and make sure that they give you the image, and that the radiologist you get the right guys to read it and have and have them put it in your record, but also understand what it's showing you. And if you need some, I know AnCan's got some stuff for Society of Nuclear Medicine and Molecular Imaging. There's a site that you can learn about nuclear medicine and all the late stage theranostics, and also the diagnostic capabilities of it as well. So ask your urologist can order it, the radiation oncologist can order it, and it's well worth doing. It's an injection and a ride through the PET CT machine.
Thanks, Bing. I did have one done a few weeks ago at VA San Francisco.
Did they show you the results?
No, I didn't. I didn't see the results. I just got the report, in my records.
Okay. Yeah, it's the next time that you get the result, they have, so this, and everybody knows this. When you get out of the PET CT scanner, they have the results on the screen right there at the back of the room. Okay. I mean, that's how fast it is. So you can ask them to see it, and it'll show you these little red dots or yellow or green dots or whatever. If there's stuff on there, it's literally showing you where your cancer is if you got it, and if it's spread, it will show up. And it's to an extent. There's obviously some people actually it doesn't work. They're not PSMA positive, so they don't get it, and you've got to go back and do a different type of test. But if it works, you're in a high 90 percentile if it's working, and it literally gives you a good picture of where you can see the cancer in your body, and it helps. I think it helps. It's helped me psychologically to figure out, what the heck they're pushing on and why we're looking at different areas and what's going on, that kind of stuff. And it just gives you a bit of a settling idea that, okay, you know where this stuff is now. So,
Right.
yeah.
Okay.
We had an interesting discussion on this yesterday as to what extent it does show up in terms of if you still have a prostate and it's in your gland. My understanding has been that if you still have your prostate, that it's not it's sort of more of a fuzzy image versus it's really going to tell you what's outside of the prostate. It's not the best thing for looking at the prostate. It's really the best thing for looking beyond the prostate.
Mhm.
And but if any of you guys find that nothing shows, then you might be one of these people, like Commander Bing says, that doesn't make PSMA. There's about 15 to 20% of guys who don't. And if that's the case, if you don't see anything, don't let it go. Have a chat with your urologist about using one of the other types of tests that we can do, like Axumin.
Yeah.
So,
Oh, it's good.
Okay. Okay, I thank you very much, Bing, and
Yeah.
we'll keep that in mind.
And Jim, I need to send you one last note about other things like blood
Okay.
cancers. Is filling out the forms for filing for disabilities and stuff. Is a blood
yeah.
cancer form, is it the same process as you file for anything else?
Absolutely, everything's the same.
Okay.
And now it just depends as to what you've got and what is the service connection.
Yeah, so polycythemia vera is what it is.
Yes.
oh, I know a
Okay.
little bit about that one, Bing. We can
Yeah,
talk.
right.
I'll speak to you tomorrow. Is this
We
for
can
you?
talk about that. And the thing is,
Okay.
so I take it you have Agent Orange, or are you under the PACT Act, or what?
PACT Act, but it's PACT Act, but it's so Gulf War, but it's my oncologist, Dr. Reddig, told me that he would attest to the fact that it's 99% caused from exposure to benzene.
Well, yeah. Well, hey, yes. Well, actually,
And it
that's
causes
what I do.
well, I've got what's called they've identified a JAK2 mutation.
Well, no. Stay away from the mutations in this. But if you are under the PACT Act, I will have to look that up. But if it isn't covered under the PACT Act, yes, you were in the Navy, you were exposed to benzene.
Yeah.
Trust me.
Oh yeah.
And
Yeah.
I've got the reports. I have the scientific study links that says yes, indeed, it will cause prostate cancer. Okay, so that's your service connection if it isn't specifically stated within the PACT Act.
Okay.
So I
Yeah.
believe it is. I believe they lump all leukemias together.
Yeah, I think blood cancers, leukemias, I think are in there together. But I just wanted to know if there was anything special or some other form that we need to consider or something.
Well, actually, I will send you the paper about the way that I believe a narrative ought to be constructed, because I don't use that VBA 214138 form, because
Okay.
that form you can fib a lot with. So I prefer to use the VBA 21-10210, and you make a sworn statement under oath. And that way, I believe they will take what you say as, the truth, because if you lie, they can send you to jail.
Yeah, right. Yeah.
So as I said, it is practically the same form, except one is then unsworn and the other one is sworn. So as I said, I prefer the sworn. And I wrote a paper on it. I have a template, and I have an example, which just so happens uses monomer as a service connection to get all kinds of things. So,
Okay. Yeah, no, I'd
okay.
love to see it. Yeah, send me that if you don't mind. I'd
Yeah.
love it. Okay.
Yeah. And I take it you have you filed before, or do you have an existing disability?
Yeah, I've got 3 appeals in, and I've got a disability. It's rated at 80 right now, but
Oh, okay.
but I've got to get. They haven't. They just reviewed, believe it or not, my appeal for prostate cancer. I
Oh,
had to appeal it. I went
why
through
did you
3 appeals for prostate cancer. So yeah,
why did you have to appeal that one since, well, was it filed before the PACT Act?
yeah, yeah,
Oh, okay. Well then, yes. And the good part about that one will be at the time the appeal comes through, you will probably get backdated all the way
yeah,
back.
yeah.
So you could come
I mean,
into a big payday.
yeah, it's been in there since 2000 November 9th of 2015. So yeah,
Well, yeah, it could go all the way back.
so yeah, and then now we're at it. So just now, yeah, if
Well,
I should send you all the appeals, it'll take you a week to read them, but you'll have a good laugh at the end of it.
oh no, 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 no. Although on the downgrading side, okay, because what they're going to do is probably premise that you had it back then, you were treated, and then you were downgraded, and you'll be paid at the downgraded rate. Now,
Yeah,
uh,
yeah,
do you, I take it that what they'll probably put you through is a CNP exam for the downgrade. And as I said, I can send you the defined benefit questionnaire, which will tell you the questions they will ask. And
yeah.
then I have the rating table that will give you an idea if you're 10, 20, 30, 40, or 60 out of
Okay,
it. So
okay.
you'll be prepared for that C and P exam. Not that a person should lie, but you need to understand the ground rules to know where you fit.
Yeah. Okay.
Okay,
That would be helpful. Thank you, Jim, for doing that.
okay, I can do that. No problem.
Okay.
Okay, I've got a Henry and I've got Henry Holloway. So is
So let me just say, Henry
okay.
Holloway was in our Care Partners group.
Yes, I have.
Sylvester will attest,
Okay,
and we weren't able to get sound. The microphone wasn't working. So I
okay.
was very surprised to find Henry Holloway over here in the other room.
Well,
So
I
I'm
haven't.
not sure what's going on with Mr. Holloway.
Henry Holloway, can you talk to us? I
I
see
don't
you're
think so.
on twice
They're
and it
on.
says on a call.
Yes, and they may be talking to. They may be talking to GoTo, because I gave him the message for GoTo support, or her the
Okay,
message. I'm not sure. We weren't sure, but we gave the person the message
okay,
to go. So that could well be. So don't get hung up on Holloway.
okay. Now, Henry, we have just a straight Henry
Oh, that's
that
Henry in
came
South
on.
Carolina. Henry, is that
You
Henry in South Carolina?
are muted, Henry.
Unmute.
Could
Sometimes
you?
he leaves the phone and wanders off. But that, I suspect that's our friend Henry from South Carolina.
Oh, okay.
I suspect.
Well, if he comes back. Okay, Joel, you came in. Do you have anything to bring up?
Yes, thank you. My journey with the VA started 14 years ago when I found out I had prostate cancer in February of 2011. And up till now, I was rated 100% temporary. And didn't matter what I did, they didn't believe me that I had prostate cancer because I make sure that I have good doctors and they treat me constantly, so therefore I stay ahead of it. So my PSA is usually 0. So I don't think the doctors understand that, but anyway, that's beside the point. Um, so I filled out a bunch of paperwork last May because they were going to reduce my amount. And so after about 80 man hours, I sent it in and they said, no, you're still temporary. So on March of 10 this year, they sent me a letter and they asked the question, are you considered to be totally and permanently disabled due to your service-connected disabilities? And they answered their own question. They said, yes. So I sent the letter immediately to Jim, and Jim says, yeah, this is it. You are 100% P&T. Is that right, Jim?
Yes. It
Okay.
said you were 100% permanent and total.
So basically, I applied for VA benefits. I got diagnosed in February of 2011, applied for benefits in May 2011, and I applied for both the disability and the loss of creative organ. But after Jim saw this letter, it says, where's your loss of creative organ and payment? I says, well, I didn't talk to Jim because I figured I'd wait till tonight. But basically, I had it when I first applied for it. And even though my amounts went up and down over the years, I assumed they went up and down proportionately. Well, obviously, I'm wrong. So, Jim, what do I do now?
Are you collecting about $3,933 a month or something?
Yes, that's correct, Jim. 396736.
Right, that's a single rate with only 100%. So you don't have the loss of use. So, I take it somewhere back in your history, you've got something that says you've got loss of use, right? I would think.
Yeah, I suspect that I did, but I'm not positive.
Well, I would drag that up and and see how far back, or in the payment that you've been getting, has when did the loss of use stop in the payment wise?
Don't know because it wasn't until you told me that I wasn't getting paid that I found out that I wasn't getting paid. I wasn't aware of it.
Okay, so you can go back in your VA file and track that all the way back of each
Okay.
year. They tell you how much you get.
Yes. Right.
And in that year, you know what 100% is because it's the same for 100% temporary as it is for P&T.
Right.
And also, you can get the history of the loss of use. And at some point, the loss of use is going to go away. Now, maybe it just happened to go away at the time they awarded you the P&T. I don't know.
Oh, so we're going to lose the loss of creative organ? Is that what you're saying?
Well, it seems that you already lost it
Yeah. Okay. Yes.
because well, there's two approaches, I think. Okay. You can just say, well, what it is, and submit a claim for loss of use
Okay.
straight away. And as I said, I have that claim probably already prepared.
Okay.
Okay. All that you have to do is to tweak it just a hair,
Okay.
and it would be a 526EZ, and your loss of use service connection would be secondary to your prostate cancer treatment. Because if you didn't have the prostate cancer treatment, you wouldn't have lost the use of your creative organ. And so now, offhand, do you take any Cialis or Viagra?
I no longer take it, but I have taken it in the past. Yes.
No, 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 now. So, okay,
Oh,
so because the trick is if you're truthful and in that part three, I contend that you put down medications, if you put down that you're taking the generic equivalent to Cialis or Viagra, the rater may believe that those drugs are there for you to be able to get an erection when they're really not. The medical use is to enhance blood flow.
yes.
So I go through a very extensive discussions about why those drugs are being taken and
Right.
what they don't do.
Right.
But you can just edit that part out, and then in the effects wise, I have some of the what I think would be the normal effects, which you can tweak easily.
Right. Right.
Thing and so it's the VBA 21-526EZ and the VBA 21-10210. You fill those out. You print them off. You sign them in the appropriate places. And then on the 210 form, the 10210, who then ever programmed that form, because those forms are literally programmed by a programmer. The VA says at the top of the form you should put your social security number. In the PDF fillable form, it will not allow you to do that. They didn't program it in so you could do it. So at the time I print those off, I then have to ink it in, sign it, scan it back in, and then upload the two using Access VA.
Okay. So what you have is a fully developed claim for it.
Yes, you have a fully developed claim, and I think the last one I had a guy took it about less than 2 months for it to be awarded.
I believe it. Yeah. Okay. Well, if you'll send me that in an email,
Yeah,
Jim, I appreciate it. Thank you.
yeah, I'll do it tomorrow in the afternoon. I got to see.
Now, just to ask the question in case somebody is wondering, is there a way to get back payment on this thing?
Well, yes. Now, as I said, if you can go back, well, the back payment you figure is going to be average, depending upon how far back. It's like $120 a month, so that's about $1,000 a year. Depending upon number of years, is it worth all of the aggravation and all of the hoops and hurdles, and then attempting to get them to take it, and to concur with it and sticking it all together in an understandable way? Do you really need the money?
Right. Okay. So,
And the grief.
in other words, what I guess what I'm really asking is, will they pay it? I mean,
No.
or is
Well,
it
if
not
you
allowed?
stick in a claim, just a straight claim, it just says, hey, start it from the time and you are good to go from that point on.
Okay.
Trying to go back is involved.
Yes. Okay. No problem. No problem. Thank you.
Okay.
Yep.
Okay, Straight Henry, are you around yet? Unmute? No. Henry Holloway, have you figured out? I've got two of you on the screen and both of them says on a call. And I don't know. Hell, I do have your information, Henry Holloway, And the good news is, I believe you contacted me about prostate cancer. And the good news is that you served 8 months at Fort Knox. And it turns out under TERA that Fort Knox is an EPA toxic waste site. And the toxic waste that is being cleaned up, and I have the reports, is for a chemical called TCE, trichloroethylene, which is a known cause of prostate cancer. So that will be your service connection. And so anyway, I will, let's see, I will get a hold of you in the next few days, and we can discuss how this is going to proceed. Sylvester, do you have anything to add? I notice you joined here. Oh, Sylvester has just left. Wow. Okay. Okay, it's about 9 minutes to go. Anybody have any questions? Michelle, do you have, oh, well, wait, Joel. Yes, you have your hand up. No, you have
Yes,
your hand.
thank you.
Oh, here.
Fort Knox was my first duty station before I went to Germany. I was being trained to be a tank commander,
Right.
and I was there for about 3 months. Do I have a claim?
Well, actually, um, since you already have the prostate cancer, you do not need Fort Knox. But if you were a brand new, okay, a major general, and you were going to claim it for the first time, yes, you would have service connection because of Fort Knox. You were there for more than a month.
Yes, I was. Yes.
Yes. So yes, Fort Knox is one of those EPA Superfund cleanup sites, and I've got the actual report of that being cleaned up, and I have the medical scientific evidence that TCE is a known cause of prostate cancer.
It's
And same,
amazing what you learn in this room, and no idea that Fort Knox is a toxic site.
well, I didn't either until I have been going to each of the military installations, Fort Sill, Fort Polk, Fort Bragg, Vandenberg Air Force Base, all of the military installations, most of them I found are toxic waste site. Now, practically every one of them has one in common, and it's called AFFF, which is also the firefighting foam, also called PFAS or PFOS. But that one doesn't cause prostate cancer. That can cause kidney cancer and a number of other issues.
Okay, I was at Fort Bragg for 4 years. What?
Well, that's another one that it has a lot of different chemicals. There are some with uh, asbestos, because any of us who were in the old World War II barracks were exposed to asbestos, which can cause the lung problems and all kinds of things, blood cancers. It's amazing. As I said, I have been building a repository of these places as I find people that come in and say, well, I was stationed at Loring Air Force Base, Maine. Well, that's another one that was an EPA toxic site cleanup. And in fact, in the I found the EPA thing where they literally had to demolish buildings and bury them in a sealed pit because it was so bad. So, yes. New Jersey, Fort Dix, I just went through him. That's a bad one. McClellan is an equally bad one because that was the home of Chemical Corps. So, as I said, even though you are not covered under the PACT Act, doesn't mean that you are not going to be able to possibly make service connection. Another item, if you were around helicopters, you were around jets, we've got jet fuel. Jet fuel burns, it creates benzene, it creates lead. There's all kinds of things that
I
you
was in the
can hang a hat on.
first Air Cav Division in Vietnam for a year. So
Right,
plenty
right,
of helicopters. I was in plenty of helicopters and airplanes.
right. So, as I said, this toxic exposure thing that they finally admitted to under TERA is one of the most sleeper because in the Gulf wars over the 20 years, there are over 500,000 people. And the thing they also did was to, unlike Vietnam, there was the Brownwater Navy and the Whitewater Navy. Well, the Brownwater said, yes, you are exposed. The Whitewater was no. Well, for the Gulf Wars, all of them, if you were on a Navy ship, it doesn't make any difference. If you were a Navy ship offshore, you're covered under the PACT Act. No questions asked. So there's a lot of good stuff out there to take advantage of. We all earned it. You should take advantage of it. Okay, anybody got anything before we wrap up here? No? Well, I'll see everybody in 2 weeks, we hope.
Great meeting. Thank you.
Thank you.
Oh, I thank you very much.
Thank you, sir. Thank you.
Enjoy.
Hey, thanks, Jim. Great meeting.
Okay, bye-bye.
Bye.
Session for all. There.